So in this video we are going to discuss about obesity, definition of obesity, history taking in obese patient, physical examination, some of the statistics worldwide, uh, the prevalence of obesity and some of the solutions. Now, what is obesity? Obesity is a metabolic disease. For those who don't know what is metabolic disease, is diseases anywhere or any disorder that generates from cellular level where there is a problem with energy production at the cellular level from the consumed food. Now, obesity is defined as when a person has body mass index greater than or equal to 30. Now, those who don't know what is BMI or body mass index is weight of the person in kilograms divided by height in the meter square. They're anywhere equal to or more than 30. Now, there is another terminology called as overweight, where the BMI is anywhere between 25.0 to 29.9. Now, why we are discussing obesity? Because obesity increases the likelihood of various diseases. Name a few: type 2 diabetes mellitus, cardiovascular disease, hypertension, metabolic syndrome, kidney disease, hyperlipidemia, non-alcoholic fatty liver disease, obstructive sleep disorders, osteoarthritis, depression, and even certain types of cancer. Now, what is the main reason behind obesity is imbalance between the consumption of energy and expenditure of energy. So, any energy consumed excess that's stored in the fat cells. Now, history taking in obesity. History taking is when a person obese walks in your clinic. So first you check is ethnicity. What is ethnicity? So obesity is more common in non-Hispanic black individuals, followed by Hispanic individuals, and followed by non-Hispanic white individuals. Second, you take family history. Why family history? So if a person has one of a parent that is obese, that increases the threefold time or 3 times more prevalence of future obesity in that kids. And if both of the parents are obese, that increases the risk 10 times more, or tenfold increase that a kid will get obesity in the future. Third is a dietary habits. Dietary habits is you eat at night, what you consume, fast food, soda. Fourth is a physical activity. Frequency of the physical activity and nature of physical activity. I can speak a lot about physical activity. Any person should do physical activity 150 minutes a day. That's 30 minutes, 5 times a day. Fifth, eating patterns, or I can say possibly eating disorders. Like name a few: binge eating disorder, night eating syndrome, you eat late at night, or bulimia. 6, depression or other mood disorders. If you are depressed, you're going to eat more. Other determinants. 7th is other determinants like drugs, steroids makes you more obese, endocrine abnormalities, hypothyroidism makes you obese, psychological factors, depression or chronic stress, or even cessation of smoking. Health consequences of obesity are very much, like as I said earlier, type 2 diabetes, hyperlipidemia, hypertension, cardiovascular, respiratory, liver disease, arthritis, sleep disorders. Now, next point, we'll come to the physical examination of obesity. How you examine a person as physically obese. So first is BMI. First step is BMI. You check the weight in kilograms divided by height in meter square. Second is waist circumference. What is waist circumference? You literally measure the size of the waist by inch tape. How you take it? Where you take it? Anywhere between the lower ribs to the superior iliac crest, you can take the waist circumference. Now, third, you check the assessment of obesity related disorders. If a person is already obese, check for diabetes, hypertension, dyslipidemia, cardiovascular, respiratory, and joint disorders. Fourth, you check the skin. Yes, skin, I'm right. Acanthosis nigricans, where you can see a black moles on the skin folds, where a person is showing the signs of insulin resistance. Now, what's the solution for obesity? The solution is must be slow and steady, where a person should lose anywhere between 5 to 15% of his or her weight over a 6-month duration of time. That is more realistic. Or you can go even 20% of overall weight reduction over the 6 months time, only if your BMI is greater than equal to 35. Now, stages of obesity. Next is stages of obesity, how severe it is. Research has showed that sources of food and quality of nutrients is much more important to recognize rather than quantity of nutrients. What you eat fast food, you eat instant food, you eat soda. These all foods are large, dense quantity of calories, so much sugar content and a salt. So that's not good for your health. Obesity is classified as 3 stages of severity. Stage 1 is your BMI falls anywhere between 30.0 to 34.9. Stage 2 obesity is your BMI falls anywhere between 35.0 to 39.9. And a stage 3 or a class 3 obesity is your BMI is greater than or equal to 40. Now there is a term called as abdominal obesity. There are other words for that is central obesity, visceral obesity, android obesity. That is dangerous. Excess fat consumption in abdominal region will lead to all the disease, like diabetes. Now why we are discussing obesity today? Because after the year 1980, weight gain has almost doubled worldwide, and if you see the statistics today, 1/3 of the population in the world is either overweight or obese. Now, how obesity develops, like development of the disease or the pathogenesis. So, regulation of calorie utilization. Your body cannot regulate the calorie. You consume more and expenditure less, or your body converts it to fat cells. Second is appetite, where there are satiety centers in your brain that tells you when you are full, but if you have a problem with that, you keep on eating. Third is physical activity. As technological advancement, we are not physically active as we should supposed to be. So fourth is a socio-economic status. As I said earlier in this video, the food sources and the quality of nutrients matters more. So the countries where low to middle income countries are getting obese more. Fifth is underlying hereditary. If one of a parent is obese or both of the parents are obese. Environmental factors, stress or other thing, depression, and large energy consumed food like soda, chips, and so on. The list is so long, that lead to obesity, large waist circumference, and even lead to increased triglyceride levels. Lifestyle, poor dietary or exercise habits, lack of sleep can make you obese. If you sleep less than 8 hours, makes you more obese. The childhood obesity is even increasing because the technological advancement, virtual games will make kids less physically active, less outdoor games will make them more obese. And waist circumference, how much it should supposed to be. If the waist circumference is anywhere greater than equal to 94 centimeter in men or greater than equal to 80 centimeter in non-pregnant women, define them as obese. Thank you.